We have 3 kids. Tom is our youngest. It was a great pregnancy, just normal birth, but by about 24 hours old, he had a seizure, and we didn't know what it was at the time, but it was definitely jarring, and called the nurse, and before I knew it, he was getting an IV in NICU, and they took him to Cardinal Glennon.
They were kind of at a loss, and then they figured out that he had some blood clots in his brain. And so they started to treat that with blood thinners and then anti-seizure medication to keep the seizures down. But really it delayed everything as far as his developmental growth, especially as it relates to his brain. And really early on it was bad. It was bad. He was at 6 months old and could hardly sit up. We got hooked up with First Steps right away, and then he came to United Services, and really that was kind of the capstone for everything that had been going on. They'd got him physically and from a speech standpoint to where he could come in here and really socialize with other kids. When we went to the ECC when he was about to turn 3 and they tested him for everything, we went from having an infant where we weren't sure how anything was going to turn out to him actually passing everything, where he doesn't have any kind of special assistance at all at this point, which is pretty remarkable, and I think it shows that the system works. If you get involved early like they did at 2 months, and to come out on the other side of that 3 years later and have him in preschool with no therapies,
Right.
Pretty incredible. So
It absolutely works.
the system works.
What's your name?
Tom Gipson.
Tom Gipson. How old are you?
4.
You wish. You're 3.
3.
There you go. Do you love this school?
Yeah.
About 2 years ago, we decided that we really wanted to branch out and develop an aquatic therapy program here in St. Charles. So we were very fortunate to be able to partner with the Renaud Spirit Center, and they graciously have partnered with us so that we can provide therapy services in their aquatic, it's called the Natorium setting. It's beautiful. So what happens is that we have one therapist for every 4 children who participate in the program. And parents come in with their child and they experience the therapy session together. The therapist really helps them learn how to interact in the pool and water setting so that there's peer interaction, there's strengthening, there are play skills that are being worked on, and also safety skills.
We've got 2 girls, Campbell, she's 3, and Quinn, she's 1, and they are a mighty group. They're out of control, but they're fun kiddos. Campbell is the oldest, of course, and she was diagnosed with autism at the age of 2. It's been a journey, but it's been very positive. A lot of great support, not only from my family, but also, I would say, the community. Towards the summer of last year, her speech therapist said, I think Campbell would really benefit from this program at United Services. Even after she had aged out, I think like a month later, we had found out about the swim club. And I'm like, well, I'm all on board, because originally Campbell hated taking baths. It was like an act of to get her to take a bath and get through that whole ceremony. She went through the program the first time, and immediately we noticed a difference. Just her, even in the taking baths, she was just so much more at ease. We didn't have to have so many props or so many toys or videos. Like, she was comfortable being in the bathtub, and it's like, whoa, this is working. This is great. It's been amazing for her to go through that program and to immediately see some of those benefits.
Ella's 5 years old. She was born 27 weeks. She weighed 1 pound 7 ounces, and she was diagnosed with cerebral palsy. So we got in the program very early. So we're lucky. We had some great people helping us along the way. First Steps.
I was going back to work, and we needed a place for her to be that could care for her. And we'd been really happy with United Services. They loved her. She was comfortable, and they knew how to take care of a child like her.
I think for Ella, it's given her a lot of confidence. Given her a lot of confidence in her abilities, kind of go outside what she can do. Also, the social aspect is great. I mean, she's a social butterfly. She loves everybody. So getting her to develop those skills is really key for her.
So when she first came here, she couldn't even sit up on her own. She couldn't sit. Someone had to hold her. She had to be strapped into a chair, and now she's pushing up on her own, sitting on her own, walking around in her little walker, and trying to do things she should not be doing by herself. So, you know, like trying to run down the hill at our house with her friends and at home even. So the skills she learned at school has been totally carrying over into her home life, which is awesome. What do you practice at therapy at United Services?
I will practice walking.
Practice walking, yep.
What else do you do?
I practice stretching.
Stretching.
Mm-hmm.
Yeah. What else?
You tell me.
I practice getting on my walker.
Getting in your walker.
In the words of Jonas Salk, the greatest reward for doing is the opportunity to do more.
I don't know what the future looks like for Campbell. I don't, but I know that I've done everything possible to help set her up for a brighter future. And this program and this organization is the piece that helped me to do it. I cannot do it alone. So every little bit helps. So if people are on the fence, do it. Just, you got it in your heart, just do whatever you can, because it's making a difference in my little life, in my daughter's life, and in others. So it's totally worth it.
He's here. He gets to play with his brothers and sisters and gets a fair shot at the same things that they did. And as a parent, that's all you ever want.
I want you to hear something.
Can you say thank you?
Thank you.